Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. There's a new bill that has been introduced. It's a bipartisan bill, and it would affect veterans, spouses, military members currently serving. And I wanted to dive into it, let you know about it. If this is something that you support, you should obviously reach out to your congressional members. Let them know, both on the House and Senate side, that you support the bill. Let's see. It is going to be in here. I don't see it. Yeah, I do. It's very long. It'll be in the description of the video. So if you want to call out the bill's actual title, you can. And with that, let's jump into it. Hit the thumbs up, subscribe, share with a friend, all that good stuff. I really appreciate it. If you want to support the channel in other ways, consider being a member. It does help me to find you quicker in the comments, and it really does support the channel. Thanks so much. Let's jump into it here. The headline, Tester, who, for those that don't know, Tester is the chair of the U.S. Senate Committee on Veterans Affairs. And so here we go. Tester introduces bipartisan bill to improve maternal health care for service members, military spouses, and veterans. The bill would identify and address challenges with military maternal health care. This news release just came out early February of 2024, so I wanted to share it with you. Let's jump into the actual release here. As part of his continued effort to ensure service members, military spouses, and veterans receive their earned benefits, Senator John Tester recently introduced here's the name of it, it's kind of long, recently introduced the Improving Access to Maternal Health for Military and Dependent Moms Act. It's long. It'll be in the description. So, Tester recently introduced the Improving Access to Maternal Health for Military and Dependent Moms Act, the bipartisan bill, with Republican Senator Marco Rubio of Florida to improve service members, military spouses, and veterans' maternal health care. The senator's bipartisan legislation would require the Department of Defense to provide Congress with a comprehensive study on access to maternal health care within TRICARE and military health care systems. For service members, retirees, and their dependents, TRICARE delivers health care services, obviously, for active duty service members, Guard and Reserve members, military retirees, and their families. There's a couple quotations here. It is critically important that mothers who are veterans, military spouses, or currently serving this country have access to quality, affordable health care, said Tester. Our bill would help make sure female service members and military spouses in Montana, because that's where Tester's from, and across the country can access the same care as civilians through TRICARE, and ensure we live up to our promise we make to them by the promise that we make to them when they sign up to serve our nation. Sorry for the bumble. Ensuring the well-being of our military families means addressing the unique challenges mothers face while they or their spouses serve in the military, said Rubio. The Improving Access to Maternal Health for Military and Dependent Moms Act is a crucial step towards understanding and overcoming the obstacles to maternal health care within the military health system. Now, here's my kind of take on all this stuff. So, for some people, this is not going to apply. I get it. However, I'm kind of, I guess, in the mindset of a snowball going down the hill. The more we can pack onto it, the stronger we are mentality. So if it is something that does not affect you, but you believe in it and you think it should be, then you should reach out and support it, is kind of my approach to this. So, almost done here. Hang on, let's roll through this. Tester and Rubio's efforts to bolster service members and military spouses' maternal health are supported by Military Family Advisory Network, Military Officers Association of America, and the National Military Family Association. As chairman of both the Defense Appropriations Subcommittee and Senate Veterans Affairs Committee, Tester has been fighting to improve care offered to service members, veterans, and their families through the TRICARE network. Following a move by TRICARE's Pharmacy Benefit Manager Express Scripts to reduce the number of in-network pharmacies in Montana and across the country in 2022, Tester demanded DOD take swift action to safeguard access to these earned benefits. He also led bipartisan effort to push DOD to proactively restore TRICARE benefits for 25,000 service members and their families who were wrongfully removed from the system in 2023 due to technical issues with the U.S. Army's new Human Resources platform. Now, that concludes the, I guess we'll call it a press release. Again, the takeaway is the name of it, right? So the entire act. I don't have the number. They don't have, which is always weird to me that they never put these things in the actual press release. But it is the Improving Access to Maternal Health for Military Independent Moms Act. And again, look, this might be something that does not affect you in any way. However, if it is something you believe in, you should absolutely support it. Reach out to your congressional member, reach out to your senator. It's really easy. All you need to do is you can call or you could swing by their office in the district where you live, and there's 3, 4, 5 staffers that work there, and somebody's going to be at the little desk, and you're going to talk to them, and you can ask them, if either in person or on the phone, is the person that handles your Veterans Affairs stuff in? And you'll get that person's name and so forth. And they kind of have a rotation. Usually these people will hang out at the congressional offices for 2, 3, 4 years or something like that at the most, usually, and then they'll jump off to something else. But in any case, you could file that number away, put the name of the person so you know who to ask for the next time you call or stop by your congressional office. And you just let them know that you support this specific act, the Improving Access to Maternal Health for Military Dependent Moms Act. They'll jot it down, whether you're on the phone or in person, and they will share that information with the congressional member. Now, the more of us that do it, the more they're going to be like, yeah, we had 30 people or 20 people or whatever it is in our district support this specific act. That might be something that you want to jump on as a co-sponsor. And, especially for make sense legislation, a lot of times, these people, the congressional members, they are not aware of every single piece of legislation that's popping around, not until it floats up onto their radar, and you as the constituency are the ones who will pop it up on their radar. So with that, thanks so much for watching. I appreciate you. Have a great one, and remember, if we don't take care of each other, something went wrong.